The management of hypoglycemia in subjects with diabetes mellitus pathway, adults whom blood glucose is less than 4 millimole per liter. Management of hypoglycemia in diabetes mellitus adults when blood glucose is less than 4 millimole. Step 1. Assess the ABC level of consciousness and ability to drink. Assess the ABC level of consciousness and ability to drink. Send the blood sample to the lab for verification, but do not wait the result. Send the blood sample to the lab for verification, but do not wait for the result. If the patient is conscious and able to drink, and if the patient unconscious or unable to drink. So, if the patient is conscious and able to drink, give 15 grams of glucose sugar orally. Half cup apple or orange juice or 1 tablespoonful sugar dissolved in water or 1 tablespoon of honey. Repeat blood glucose test after 15 minutes. If the blood glucose is still equal or less than 4 millimole, repeat the process 2-3 times till glucose is more than 4 millimole. Then give a snack of 15 to 20 grams of complex carbohydrates such as 1 toast. So, if the patient is conscious and able to drink, give 15 grams of glucose sugar orally. It is half cup apple or orange juice or 1 tablespoonful sugar dissolved in water or 1 tablespoon of honey. Then repeat the blood glucose test after 15 minutes. If the blood glucose is equal or less than 4 millimole, repeat the process 3 times till the glucose is more than 4 millimole. Then give a snack of 15 to 20 grams of complex carbohydrates such as 1 toast. If the patient is unconscious or unable to drink, intravenous access is secured. If the case is mild or if it is severe. If it is mild, 2.5 to 4 millimole, between 2.5 to 4 millimole is mild, then administer 25 ml from 50% dextrose IV over 1 to 3 minutes. Then repeat the blood glucose test in 5 minutes. If the blood glucose is still equal or less than 4 millimole, re-administer the dose and check the blood glucose using finger stick in 5 minutes. Repeat the process until the blood glucose level exceeds the 4 millimole. So, in unconscious patient unable to drink, secure IV access. In mild, from 2.5 to 4, administer 25 ml from 50% dextrose IV over 1 to 3 minutes. Then repeat the blood glucose test in 5 minutes. If the blood glucose is still equal or less than 4 millimole, then re-administer the dose and check the blood glucose using finger stick in 5 minutes. Repeat the process until the blood glucose level exceeds 4 millimole. In severe cases, when the blood glucose is less than 2.5 millimole per liter, administer 50 ml of 50% dextrose IV over 1 to 3 minutes. Repeat the blood glucose test in 5 minutes. If the blood glucose is still equal or less than 4 millimole, re-administer the dose, 50 ml of 50% dextrose IV over 1 to 3 minutes, and check the blood glucose using finger stick in 5 minutes. Repeat the process until blood glucose level exceeds the 4 millimole. If no secured intravenous access, then administer 1 gram of glucagon subcutaneously or intramuscle. 1 milligram, 1 milligram glucagon subcutaneously in or intramuscle. Repeat the blood glucose test in 15 minutes. If the blood glucose is still equal or less than 4 millimole, re-administer the dose and check the blood glucose using finger stick in 15 minutes. Repeat the process until the blood glucose level exceeds 4 millimole. When the patient is conscious and able to eat, give a meal of 30 grams of complex carbohydrates such as 2 to 3 toasts. Step 3. Step 3. Assess and manage the precipitating factor. Step 4. Adjust the dose of insulin and other hypoglycemic agents. Call if any of the following. Do the call consultant if any of the following. Patient is both nil per oral, tube feeding, or TBN initiated or stopped, persistent nausea, vomiting, deterioration of the level of consciousness or seizure, or patient who presented with hypoglycemia secondary to long-acting sulfonylurea. There may be need for prolonged observation. Thank you.